Thank you, Captain Stoddard, for SBIA's continued support of the generic drug program. On behalf of the Office of Generic Drugs, thank you all for being here today at the 2024 Generic Drug Forum. I'm honored to open this event alongside my colleague, Susan Rosenkrantz from the Office of Pharmaceutical Quality. Today, you'll hear presentations on resources, best practices, common deficiencies, and opportunities to engage with the agency from pre-ANDA to post-submission activities. Now, before we jump into the many insightful presentations and actionable tips you'll hear from the CDER staff today, I'd like to set the stage by providing an overview of what I see as our goal in holding this event. How collaboration and using FDA tools for success can result in increased approvals. The forum is an effort to help applicants submit complete and high-quality applications, to maximize the efficiency and utility of each assessment cycle, and to reduce the number of assessment cycles, facilitating timely access to safe, effective, and high-quality generic drugs. Maintaining a collaborative working relationship between FDA, researchers, and industry is one way I believe we can accomplish our mission. Discussions like this one we will have today play an important role in helping guide and generate new and better ways to support the development of more efficient bioequivalent approaches, advanced analytical tools, and other innovative methods that can lead to more complete ANDAs and more first cycle approvals. For the next few slides, I will talk about some of the people at the heart of these valuable collaborations. First, I like to ground our work in why each of us in the generic drug program knows why the work we do is so important. I'm proud of our We Are OGD campaign, highlighting personal stories from our staff on why they are dedicated to serving the public health mission, and particularly the generic drug program. This quote is from one of our staff members. And for me, I do appreciate firsthand that not all brand name drugs of the same class are equally effective or safe for an individual, and that having generics for individual brand name drugs is important. One particular experience comes to mind. Years ago, I was hospitalized, and during the hospitalization, I was given IV medication. And then after discharge, I was switched to an oral version of that same product. But when I went to my pharmacy, they didn't cover the brand name product. And so, trying to be a little bit, practical, there are other products in the same class, and, I was okay with it being switched to something that was covered under my insurance. So that night, after dinner, I took my medication, but, in the middle of the night, I woke up feeling really nauseated, and that was different from when I was in the hospital. So the next day, I re-challenged myself, said, okay, is this a one-time thing, or is this something with the medication? Because the medication was the only new thing. And sure enough, the middle of the night, I woke up feeling sick to my stomach. So the third night, I de-challenged myself, right? I held the medicine, and I felt much better. So then the fourth day, I just paid, for the brand name product out of pocket. And, fortunately for me, I am able to afford that. But, I think for a lot of families, that would be a challenge. And so just, my personal experience in that, having generic products, it really can, make a difference for individuals. I can tell you what a professional, insightful, and thoughtful group of employees FDA's generic drug program is made of, and I'm excited for you to get to spend the next 2 days hearing from them. OGD is a high-achieving, resilient group of dedicated professionals. It's really a special place to work because the staff fully embraces our mission of supporting the public health through access to generic drugs. Our current strategic plan focuses on fostering an engaged organizational culture that attracts and retains a highly qualified, talented, and diverse workforce empowered to carry out the mission of OGD. We do receive messages of appreciation for the important and insightful work of the various OGD employees that you interact with. Here's a recent example of messages to people who make an approval possible. Similar to the new drug program, we want to ensure that patients are heard. We have a number of opportunities to engage and empower patients. For example, there are opportunities to participate in the public meetings and conferences held by FDA, as well as public solicitations for input on the user fee program negotiations. GDF research programs support the investigation of generic drug development challenges and help us establish and clarify the scientific framework for ANDA development, submission, and assessments. We have a public meeting each year to help set research priorities. Additionally, we meet with stakeholders on a regular basis throughout negotiations. Per the GDF commitment letter, not less frequently than once every month during negotiations with the generic drug industry, the Secretary shall hold discussions with representatives of patient and consumer advocacy groups to continue discussions on the reviews on the reauthorization and their suggestion for changes. OGD funds research grants that investigate specific views and concerns from patient perspectives and further identify allowable differences where patient preferences can help set research priorities. Patient contribution spans across all stages, and we encourage integrating patient input into generic drug development and decision-making. In the translational stage, collecting patient experience with brand drugs can assist developers in creating a more robust development pathway, ensuring product development success. The pre-market stage user experience of proposed generics helps assess the allowable product differences that could impact patient perception and patients' ability to accurately use the drug product, or even further identify potential safety issues or unexpected safety considerations. In the post-market stage, patients are integral for safeguarding the American public by sharing and reporting safety information and drug shortage reporting to secure our supply chain. Next, I would like to talk about our tools for success, which is really what this event is all about. Here's an excerpt from the email from industry that I thought captured the collaboration and tools we're discussing today, as well as the outcomes we're all looking for. They write, "The first generic represents years of engagement with FDA, made possible in part thanks to a multitude of tools available through the GDF program, including post-CRL teleconferences to resolve several complex issues and insights provided through GDF science initiatives, all culminating in complex synthetic peptide product approval." The Generic Drug Forum is all about providing actionable advice. So here are some tips from the pre-ANDA, ANDA, and suitability petition side of things. For product, the first thing is, remember, we have a lot of different meeting types, so request the appropriate meeting. For example, for product development meetings, include specific proposals and questions. Make sure you include sufficient rationale and support for each of your questions. Avoid questions that are review issues, and then choose the best meeting format for your questions. And in terms of pre-submission meetings, we do offer face-to-face, video, or in-person meetings. These tend to be not question-based, but really are an orientation to your submission, and let assessors kind of know if there's any unique or new information in the submission. And you want to consider submitting meeting package in the format of a draft presentation. And then we have many resources, and some of them are listed there. In terms of ANDA submission tips, I can't emphasize enough, submit a very clear and thorough cover letter. It can save both you and us a lot of time. Make sure it's very clear on what is being submitted. State if the submission includes proposed labeling carve-outs. We strongly recommend the cover letter attachment, especially for unexpected or unsolicited information. If you're including data submitted to a discipline, and then if you're submitting a large, complicated submission, having that cover letter and attachment really helps to identify what's in there, and it helps to allow better triaging of your submission. Make sure you respond thoroughly to any sort of requests. Monitor any updates. Make sure you know what changes are happening to your RLD, USP, guidances, Orange Books, and make sure you submit timely litigation-related updates, and make sure that you remain in good standing. Recently, we've had a lot of data integrity concerns. Make sure you coordinate DMF changes, and then pay attention to patents. In terms of some GDUFA 3 enhancements, we do have goal dates for product-specific guidances after a complex product for a new drug application. Our first goal dates hit us in October 2024. We do have new product-specific guidance meetings, and there's a guidance out there providing more information on that. And then I think people have appreciated that ANDA assessment team members are included in pre-submission meetings. Suitability petitions are a request to submit an ANDA with certain differences from the RLD. Examples are differences in strength or dosage form. The current GDF agreement has goal dates associated with suitability petitions as shown. Furthermore, we will prioritize suitability petitions for certain reasons, such as mitigating drug shortage situation or addressing a public health emergency. For FY24, we've had so far 80 submissions. Half of the responses issued have been issued already, and more grant decisions were issued as compared to denials. Now, we do have enhanced communications for complex generics. Remember that before an application is submitted, we do have pre-submission meetings. You can use this when you do new or unique studies for complex generics. And information shared does help FDA form an assessment team early and coordinate between product development meeting and application assessment. After your application is submitted, we do have, as an example, post-complete scientific response meetings. After you receive an CR, you can use this when you need to do new and different studies for complex generics and get advice before conducting those studies. The GDF Science and Research Program is an essential component of FDA's mission to protect and promote public health. Each fiscal year, multiple sources of public input and experts across the generic industry collaborate to establish science and research priorities that can help expand and accelerate patient access to generic drugs, especially for the most pressing scientific challenges with generic product development. Scientists and clinicians from industry, academia, and FDA then strategically design studies so that the research outcomes enable us to build scientific bridges across the knowledge gaps, which then advance research in those areas. These outcomes are published in an annual report describing the corresponding activities. The outcomes of this research help FDA establish efficient new pathways for pharmaceutical manufacturers to develop generic drugs that were previously challenging or infeasible to develop. Innovative tools enhance the understanding of complex drug interaction and mechanisms, aiding in the development of generics for more intricate formulations. Robust scientific approaches, including analytical techniques and bioequivalence studies, enable accurate assessment of generic drug quality and equivalence. Meanwhile, this field of regulatory science constantly evolves, integrating technological advancements and innovative research methodologies to streamline the approval process. Challenging ourselves to continue to push for generic drug access for all kinds of products expands patient access to their medications. And we see this happening right before our eyes within FDA's adaptive and robust generic drug program. Let me highlight just a few of the many results of our FY23 GDUFA Science and Research. PSGs are a key tool FDA provides. The outcomes from the GDUFA-funded research expand our understanding of drug products and often contribute to the development of advanced methods to characterize product quality and performance. FDA's recommendations related to bioequivalence issues and product quality are communicated to the generic industry through continued publication of new and revised PSGs, as well as general guidances for industry. PSGs help prospective generic applicants understand our expectations, focus their product development, and prepare for ANDA submissions, and mitigate certain risks associated with generic product development. The development of these PSGs also facilitates our assessment of ANDAs for corresponding products once submitted. The recommendations in many of these PSGs would not have been possible without the GDUFA Science and Research Program. In terms of the pre-ANDA product development meetings, in addition to informing FDA guidances, GDUFA research also allows us to evaluate whether proposed BE approaches presented to FDA in a pre-ANDA product development meeting are likely to be suitable or not. GDUFA research outcomes enable FDA to provide prospective ANDA applicants with timely technical advice that helps them prepare their submissions in a manner compatible with the most current scientific insights and regulatory expectations. We've collaborated for many years now with the Center for Research on Complex Generics to expand our collaboration and communication with industry, help industry develop complex generics and implement FDA scientific insights, and help inform the GDUFA research. We've also taken on new efforts and pilots, such as the Model Integrated Evidence Pilot. We also provide information in a variety of ways, including online and in our OGD annual report. We hope you'll continue to keep yourselves informed through your RPM, our public communications, and events such as this. In fact, as Captain Stoddard pointed out before, we have other important meetings, workshops, and webinars coming up in the next couple of months, and I hope to see you at the next week's Modified Release Oral Drug Product Workshop. We are grateful to all our collaborators within FDA and at institutions around the world and throughout the global generic drug industry. We are committed to continue providing tools and support as you do the important work of developing generic drugs and getting them to the market. Last year, we had a record number of approvals considering both originals and supplements. We remain confident that our collaborative engagements are the most effective way to bring about access to more generic drugs. Thank you to the dedicated FDA staff who organized the Generic Drugs Forum, especially those in OGD, OPQ, and SBIA. And thank you to the members of the audience participating today. I do hope you find this forum to be informative and insightful. And now I'm honored to pass the mic to Dr. Susan Rosenkrantz. Thank you.